Hi, everyone. It's Dr. Paul from the East Ontario Health Unit with another update today, June 1st, 2022. I'm going to share my screen as usual right now. And we'll start with local statistics here. This is the statistics as of yesterday of our health unit. We are down to 5 hospitalizations, including 1 in the ICU. And if we go to our hospitalization numbers, you can actually see that overall the numbers are going down. We've still got some patients hospitalized who are positive for COVID. But if you go down to the patients that are actually admitted for COVID in our 4 hospitals, that is on its way down as well, slowly, but it's the trend is on a downward direction. If we're looking at our percent positivity, again, there's good news right there. We're sort of hovering between 7 and 8%. Actually, we're 7% right now. The provincial average is around between 8 and 9%. So that's again going down very slowly. The same for our wastewater. Again, you could see Hawkesbury's sort of flattened down. You can see Cornwall flattening down, and you can also see as well Castleman flattening down as well. So those are good trends. In terms of our outbreaks, again, slowly but surely they're going down as well. We still have 9 in our jurisdiction, but that again is much less than we had about a month and a half ago or so. The other issues that we are dealing with now are really our vaccinations. And if you look at our vaccinations moving forward, we're now, slowly increasing, but not much of a change since last week. You could see again, the green is the 4th. So we're at 53% of our 80 plus have got their 4th dose, but you could see the others are much less than that. The gray is the 3rd dose. And again, I can't stress enough the importance of getting your 3rd dose. That is really going to help us with our numbers moving forward, going into the summer months. I'm just going to give you a quick look at the provincial data as well. You could see here that this is the wastewater provincially, and you could see again, Eastern is down. Everyone is going down or leveling off, and provincially, the trends are downwards as well. If you're looking at ICU admissions and cases, they're all on the way down as well provincially. And I just want to, there's one more that I want to show you. I had another one here. Oh, yes, here it is. I'm going to just put it up. It's the provincial scoreboard. This is the average weekly cases in public health units, and you could see that the numbers are down across the province, and that is something that, again, we're keeping a close eye on in terms of those numbers. And again, just to show you, if we're looking at this slide here, again, most of the cases that are admitted to ICU in terms of rates and hospitalizations and deaths are among the mostly of the unvaccinated and among the elderly as well. And then we can, if you look at sort of this graph here, again, we see a trajectory again of this last wave where again, the ICU cases are down, which is the red here. This is hospitalization, which is down, and the daily new cases, the averages are going down as well from that. So basically, again, we are going in the right direction. Our numbers are now showing that COVID is still around, but less of a threat to us, and so we are continuing to be monitoring the situation. As you know, the government has extended travel requirements with people returning until the end of June. That's because we're still in a worldwide pandemic, and we really need to be careful to ensure that we don't get any variants coming and so on. So that's going to be reevaluated month by month. For now, I think what we can be doing is, again, it'll be less. I think the trajectory or the rate is going to drop to a certain level. We're still going to have cases, but to the point where it's not going to have a significant impact on our healthcare system, which is now starting to recover. We're just again waiting to see what happens in the fall. Again, looking out for possibly 4th dose for people less than 60, looking for perhaps another booster dose for people in long-term care, and waiting for approval by Health Canada for the 0 to 5-year-old age group vaccination. So those are the things that we're doing right now. Just a reminder, as we get into the summer, our programs to remind you of West Nile virus, Lyme disease, those type of things as you go outdoors. More and more people are going to be going outdoors this summer, so just be careful with those things. things. And obviously sun safety and water safety, those are all the things that we're going to be cautioning you about, but it's going to be, I think, a more normal summer, and I think we're all looking forward to it. So thanks again for all your cooperation. And again, please stay vigilant, get your third, get your fourth dose. If you haven't got your first or second dose, go get it. And also, please maintain, some of the public health measures, washing your hands, sneezing into your sleeve, not going out when you're sick. And it really, just because there's no mask mandate, if you're uncomfortable or you're in a large indoor crowded situation where you don't know people's vaccination status, you can feel free to wear a mask. Thanks again. I'll talk to you next week.